All right. We stand here with Professor John Halamka. He's a Harvard-educated doctor, and you just have delivered a very exciting presentation here at EHiN. So, to sum up, what is your advice to the Norwegian healthcare authorities how to speed up the digital innovation in this country?
Well, sure. So recognize that the future is going to be an ecosystem of apps and cloud services and not just a monolithic electronic health record. You do need an electronic health record to get data in, to send bills, to do public health. That's great, but innovation has to happen around it. And there has to be an urgency. So I think of Norway as a place that has a vast distance between cities. You must have telehealth and telecare. There's no other way you're going to be able to deliver the specialty care, especially to rural areas or areas that are further north. So build those apps, encourage an ecosystem of development, and embrace the standards, these emerging standards like FHIR, that will enable those apps to talk to the electronic health record.
You are working with Cerner at the moment, and Cerner is, for Norwegian, there's a gigantic EPJ company with more than 5,000 hospitals in the USA on the customer list. Now they are using Apple Health, where they make all their data available on this platform. Can you tell us a little bit about that?
Sure. So Apple wants the consumer, wants the patient, of course, to use an Apple phone.
Sure.
So Apple itself is not offering an electronic health record, but they build into the phone the tools to access electronic health records like Cerner and Epic. Epic and Cerner have made their data, as you say, available to any patient with any insurance at any institution who wants to get their own data. There's nothing that is restricting you. If you have data, the data is yours.
So this is actually the future of healthcare.
Right.
So why don't the Norwegian government and Norwegian hospital do this?
Well, I of course don't know the politics of Norway, but the issue is never technology. It's always psychology. And that is there a will? Is there a risk they're concerned about? That I can't say. But I think the answer is if there's an urgency, the patients want it, the economy needs it, and especially as we talked about with telemedicine exploding and telecare that's necessary, they should embrace it.
That is fantastic news. So to break the deadlock in Norway, what should be done in your opinion?
Well, I travel 400,000 miles around the world looking at what every society has done, and I openly share every lesson learned. So if there are any concerns or there are any roadblocks, chances are another country has already dealt with them. And I am happy to say, here's what the US did that worked and didn't work. Here's what China is doing that worked and didn't work, and maybe that will break a deadlock in Norway because they won't be the first. They don't have to have that fear of trying a voyage into the unknown.
One last question. What is the positive impact for the patients of now being able to having control over the health data and to give all other doctors access to it? What is the positive things for a patient and for a person?
Well, higher quality, lower cost, more convenience. But here we are standing in Oslo, and my mom lives in LA. And my mom is 81. Let's go take a look at what the temperature in her bedroom is right now. Okay, so this is my mom's bedroom. Oh, maybe we should convert this to Celsius for your audience.
Yeah, that's
there you
good.
go. Okay, so my mom's bedroom's at 22 Celsius right now. So why do we care? Well, my mom, 81, I don't want her to be too hot. I don't want her to be too cold. I can monitor her life. And in fact, we can go even click a button and we can bring up the camera that I have with her permission in her house. Now, of course, it's going to be like about 2 in the morning right now at my mom's house. So it's
a little bit dark.
Yeah, so it's going to be, but there you go. There's my mom's house in real time. We can see, has anyone come to the door? You know, what is going on at her house?
Yeah. And what you just showed me, this is Nest, where it's available for Nest to integrate with Cerner's system so that you can see everything you have access to.
Well, in this case, I'm just running apps on my phone.
Yeah.
And they're Google or Nest or whatever. And I do this, again, it's because I am caring for my mother at a distance. And no matter where I am in the world, I can make sure she's okay.
Great. It's an exciting future. How do you think the international American healthcare will be, let's say, 10 years from now? How will it change?
Well, of course, I made this controversial statement in my keynote. The future of healthcare is not in hospitals or doctors' offices, it's in your home and on your phone.
Occupational health is a huge issue in US and in Norway, of course.
Right.
So what can the new digital solutions bring of advantage to customers and to employees in Norway and America?
Right, and so the idea with this Apple Health Kit is we're taking data from every place you receive care, whether that's a hospital, doctor's office, or an occupational health practitioner. Now, you also often with occupational health will want to gather telemetry about life. So there, let's take one more example.
Sure.
Maybe because I am having a very stressful time at work, I'm not sleeping well. Okay, so here we go. I have a sensor in my bed, and look, we can now actually track all of my sleeping and how my work schedule and my sleeping align. And these are the kinds of things, full integration of data around your life to help you not only in the home, but in the workplace.
So that will make you a more healthy person, more productive person for your employee, and is what you say a win-win solution for everybody.
Well, no question. And so obviously employers want healthy workers, and it's far better to invest in their wellness than to pay for their sickness.
Excellent.